Hello Brightstar employees, thank you for watching this video. It's open enrollment there at Brightstar for your health insurance, dental insurance. So that is August 1st. So we're here today to let you know that you have an opportunity to enroll effective 8/1 if you have declined the coverage in the past. You can add dependents, drop dependents, all of that is available to you August 1st. You can add dental if you didn't enroll. You can add and drop dependents. And just so you know, the dental and the health are not tied together. So you can carry dependents on the health and not on the dental, or vice versa. Carry your dependents on the dental, or a different set of dependents. Maybe just your spouse on the dental and cover your kids on the health. Okay, so those are separate things. So anyway, we're going to get started here. All of this information needs to be turned into Felicia. Hopefully as quickly as possible. We're not having your meetings actually though until the 13th here in Lubbock and on the 15th in Amarillo. But once you could go ahead and turn this stuff in. If you're one of the people watching this video, that means you're probably not going to attend one of those meetings, but you could. But let's just try to get that stuff in so that we can get the changes made, and especially if you're a new enrollee, get you into the system. So maybe no later than the 20th, if you could have your stuff to Scott or Felicia so we can get the open enrollment closed out and go forward. If something changes after that date, technically our open enrollment is until the end of July. So if you come in on the 30th, we're still going to be able to make the change. It's just you won't be in the computer ready to go on August 1, and that's what we want. So our office is here in Lubbock. Many of you know me at Ross Schamberger. Ashley Allen is my assistant. And if you ever have a question or a problem, you call our office. We'll be giving pins with each one of these packets. It's got our office number on it. And our office is located at 12215 Quaker. So you're welcome to come out here if you need some help. But certainly call us, email us, whatever. So anyway, going forward, you should have a packet. It's going to look like this. Okay, and in that packet is the letter explaining its open enrollment period. Right behind that are 3 summaries of benefits and coverage. In the insurance world, we call them SBCs. Okay, y'all have available to you, it's Blue Cross. The 3 plans that you have a choice of are staying the same as far as the plan selection and the deductibles, that kind of thing. But you may want to migrate from one plan to the other. You're not adding dependents, you're not dropping dependents, you just want to go from maybe the high deductible to a lower deductible. Of course, the cost is going to go up when you do that, but effective August 1st, no questions asked. You can do all that. If you're adding dependents, no question asked, pre-existing conditions covered on day 1. All right, so you could be pregnant and deliver on August the 2nd and it will be covered. So just so you'll know. So you got a choice of 3 summary of benefits and coverage. The one that's on the top is going to be the high deductible, which is an $8,550 deductible. Now they did raise that sum. The Affordable Care Act dictates to employers how high the deductibles can be and how much the out-of-pocket can be. And for 2021, $8,550 is the highest out-of-pocket that any plan can have. So this first plan is an $8,550 deductible. And since that's the maximum out-of-pocket, then it pays 100% once you've paid that amount. All of your office visits, your prescriptions, everything go toward that $8,550. If you carry your family, $17,100 maximum out of pocket, no matter if it's you, your wife, and 10 kids, $17,100 is the maximum out of pocket for a family cumulative, but never more than $8,550 on any one person. Okay? Keep in mind, even though our anniversary date's August 1st, January 1 is when benefits start over. New deductibles start over every year on calendar year with every carrier. Okie doke. So when you flip the pages, you're going to see everything just says no charge after deductible, no charge after your deductible, because it's 100% after that first $8,550. This is the lowest cost plan that Blue Cross offers. So that's why we have that in there. People say, well, I just want coverage to protect me. I don't want to go bankrupt because of that. I never go to the doctor. I want the cheapest plan, and right here it is. So if you want to get on that, or if you're on it, that's good. And let's talk just briefly now too. There is an enrollment form in the packet, and what I would suggest, if you're making changes, certainly you have to complete that enrollment form. if you're not making any changes on plan or adding dependents or anything, go ahead and fill out the top of that enrollment form, write no change across the front of it, go over and sign it and turn that in. That way Scott and Felicia know you've made a decision. They don't have to come track you down and say, were you going to make a change on the open enrollment? That would really assist them. So if you would, please turn in your form, no change, put your name on the top, sign it, and turn it in. Okay, that'll help a bunch. All right, the next summary of benefits and coverage is still HMO. Let's cover that for a minute. HMO here in Lubbock is UMC Lubbock Heart Hospital. Okay, so PPO is going to include Covenant. So that's the big difference for you folks in Lubbock. And I realize most of you are here in the Lubbock area. Few people in Amarillo, but they don't come to Lubbock for health care. So in the HMO, you can't go to Covenant doctors, you can't go to Covenant Hospital. That includes Grace doctors, Grace Hospital. It's UMC, Texas Tech doctors, some independents. My own personal primary care doctor is independent, but he is in the Blue Cross HMO. All right, so that's important to know. So when you pick that, just know you're limiting where you can go. But that's also why the rates are about 35% cheaper than the PPO. Alrighty. So the second plan you have there is a $6,000 deductible, $8,150 maximum out of pocket for any one person, 2 times the $6,000 deductible for a family, so not more than $12,000, $16,300 maximum out of pocket for a family, so that's just 2 times the $8,150. This one does have a copay when you go to the doctor, so it's a $40 PCP visit. Under HMO, you have to pick a primary care physician, therefore PCP. So pick that doctor. If you want to change doctors, or if your doctor leaves, retires, whatever, all you have to do is call the number on the back of your ID card, pick a new doctor, call them and say, I need to change my PCP to whatever. They will actually allow you to change that PCP no more than once every 30 days, but you could theoretically do it 12 times a year if you wanted to call in every 30 days and change PCPs. All right. So to see a specialist, you've got to get a referral. Without that referral, that specialist should tell you we can't see you. Okay. So you've got to stay in network. That's a big difference under HMO compared to PPO. There is no out of network benefit. So you just can't say best doctor in all the world's in Dallas, Texas, and I'm going to go there. Well, if they take Blue Cross Blue Advantage HMO, you can. But if they don't, you cannot. It would not be covered. Okay. Now, emergencies are a different situation. If you've got HMO, you're on vacation, you're over in California doing the Hollywood thing or whatever, and you have a car wreck, you have a heart attack, or you have some emergency situation, then yes, they will process that claim. You just can't elect to go to somebody that you think is the best knee surgeon in the world and schedule a surgery 2 months from now and go get it done. It's not going to be covered. Okay. But emergencies anywhere you're at would be covered under the HMO. So don't fear that. Some people think, oh, I can't do that. I travel a lot. No, you can. Okay. $80 visit when you see a specialist once you get that referral. So once you go in and you have your diagnostic test, you pay 10%, they pay 90%. If you're going to have any of the big tests done like CAT scans, PET scans, MRIs, there is a $250 copay per test. Okay, but the deductible does not apply. So you'll pay $250 for an MRI that might cost $2,000. And then the next page, page 3, shows you your prescription benefit. Blue Cross has not changed. They don't go to dances with CVS. That used to be their preferred pharmacy. CVS actually was bought by Aetna, if you didn't know that. So at that point, Blue Cross split sheets with CVS. So with the Blue Cross prescription benefit, you can go to Walgreens, you can go to Walmart, you can go to the Market Streets, the Uniteds, all that thing, but just stay away from CVS. You probably already know that because that's been that way about 3 years, okay? So nothing has changed. Prescription benefit is just the same. They've got 6 tiers of prescriptions. So it's the preferred generic, non-preferred, preferred brand name, non-preferred brand name, preferred specialty, and non-preferred specialty. So when you get down into those specialty drugs, the copays, as you can see, are $150 or $250. Those are drugs that cost at least $500, and often they cost $5,000 or $10,000. We see prescriptions come through way in excess of 10,000 bucks for one script. So I hope none of you are on those, but you do. It's covered. You're just going to have to pay a little bit more of it. So if a doctor gives you a prescription and you get to the pharmacy and it costs more than what you want to pay, you need to go back to your doctor, because nearly all the time there is another drug that's in that family of drugs that he can change that prescription to, so it doesn't cost you so much. But that's between you and your doctor, okay? So when you turn the page to page 4, if you're having outpatient surgery, there is a $200 facility fee. Then it pays 90%, you pay 10%. Again, on the physician surgeon, you're going to pay 10%, they pay 90% after you've met your deductible. Same thing with the MRIs, CAT scans, it's after you've paid that $6,000 deductible. So emergency room, they're just trying to get people to stay out of the ER unless it's really an emergency. There is a $500 copay per visit if you go to the emergency room, okay? So often it's, you wouldn't believe it, but often we see people go to the emergency room for the flu, or for they've got diarrhea or whatever. And it's, now you're talking about an emergency room visit that's going to cost 5,000 bucks just to tell you have the flu, or 10,000. That's a true story. Go in, tell them my chest hurts. Well, the reason the chest hurts, they've been coughing so much, but they fail to tell them they've been coughing so much. So they hear my chest hurts. Next thing they know, they run a battery test looking for a heart problem and spend 10 grand to tell a guy that he's got the flu. So try to stay out of the emergency room. Lubbock is blessed to have a lot of these 7-day-a-week clinics. That does not include, though, the Star ER and the ERs that Covenant owns. Those are true emergency rooms, and they cost just like a hospital. And you're going to have a $500 copay when you go into one of those places. So then let me give you my opinion on those freestanding ERs. They can save your life. If I was having a heart attack, I would not drive past Star ER just to get down to Covenant or UMC. I would stop at Star ER. They've got all the clot busters and all that kind of stuff that they use nowadays for people having strokes and that kind of thing, heart attacks. I would stop there. They'll save your life, and then they might transport you to the hospital. But they are true ERs, and that place is staffed by some really great doctors. So excuse me, a little hoarse today, and if I hiccup, forgive me. I've had the hiccups since 7 o'clock this morning, and I don't think I've had the hiccups in the last 10 years, but I got it today. So anyway, so going right on down, you can see urgent care, 80% for your $80 for your visit, but the deductible does not apply. So if you go to one of the urgent care facilities, and some of the places are urgent care, some of them are not, there'll be an $80 fee. So that's freestanding. Like I know the Covenant Clinic down at 19th and Quaker by the Market Street, that is an urgent care center. And so your visit would be $80. An urgent care center can do stitches. If you stop at one of these normal little clinics, they're going to send you to an urgent care center when all you maybe really needed was 3 or 4 stitches for a cut. But they pretty much stopped doing those type of things, sutures, in just a clinic. And I really don't understand why, but they do. So when you go have a hospital stay, there is a $250 copay if you're going to spend the night in the hospital. And then the plan pays 90%, you pay 10%. So same thing on physicians and surgeons while you're in the hospital. Okay, so for mental nervous, the office visit copay there is going to be $40 for an office visit, which is just like seeing your PCP. If it's inpatient, now you got a $250 copay, and then 10% after your coinsurance. So that basically the inpatient stays subject to your deductible if you haven't met that $6,000 deductible. When you go on down to pregnancy, it reads just like everything else. $40 copay to see a primary care doctor, $80 to see a specialist, $90, $10, $250 copay for childbirth and delivery facility services, subject to your deductible. Any surgery you have is subject to your deductible. All right? So just know if you go in and a test is a couple $1,000, whether it be a PET scan, CAT scan, MRI, they're going to be subject to your deductible. Home health care, all of those things are covered, but they're subject to your deductible, and then they pay 90%, you pay 10%. Okay? Get at the bottom if your child needs dental care. There is not dental insurance. We do have Principal Mutual Dental Insurance, and if you're enrolled in that, then it'll pay, but it'll give just an exam. All they're going to do is open your mouth and look and say you got 5 cavities. Now you need to go see a dentist and get them filled over there. Or they'll do an exam for vision, but it's not going to be the same vision exam that you would get from a doctor that specializes in eye care. So just know that. But it may be standing at the end of the hall and you put one hand over your left eye and you read the little chart. Okay, but those are covered at no charge. I didn't mention earlier, preventive care on all of the plans is covered at 100%. So if you just want to go in, you're healthy, you feel good, you just need to get a checkup. You haven't had your cholesterol checked, you don't have a clue what your blood pressure is, go get a routine checkup. And as long as that doctor files that as preventive care, you won't pay a dime for it. It is free, okay? Again, it's got to be in network. But go get those checkups, so all of you. All right, so that's the second plan. Again, that's 2 plans now on HMO. The third plan, actually, which has the most people on it, is PPO. So now you've got Covenant and UMC, you've got the Heart Hospital, you've got Grace. It's really everybody. North Star for Surgery Center. The deductible on this plan is $3,250. They tripled that now to $9,750 for a family. On the prior 2 plans, they just doubled it. Okay, the out-of-pocket maximum is $8,550, which is similar. So if you have a $100,000 car wreck on this plan, you're going to be out of pocket $8,550, just like you would be out of pocket on the first plan that has a $8,550. The second plan had a $8,150 maximum out of pocket. So from that standpoint, they're all capped at the same thing, again, which complies with the Affordable Care Act. So when you flip it over to page 2, you're going to see that it's got a $50 office visit copay to see a primary care doctor, but you do not have to pick a PCP. You do not have to get a referral to see a specialist. Specialist visit's going to be $80. You just got to stay in network. If you do go out of network, there are benefits, but the benefits are reduced considerably. Your deductible is increased, but it could still be covered. So if it was a big enough charge, you might still get some payment, where under HMO, if you go out of network for an elective procedure, it's not going to pay anything. Okay, so that's the difference between HMO and PPO. Then as you go on down, you're going to see that this plan pays 60%. You have to pay 40%. So for those diagnostic tests, imaging, CAT scans, PET scans, that's 40% after you pay your deductible. Okay, $3,250 on your deductible. So that part did not change at all. So then when you get to prescription benefits, the same. All 3 plans, prescriptions are treated the same way as they are today. Of course, on the first plan, it's subject to your deductible. Okay, and again, the network is just like it was. If you have outpatient surgery, this one has a $200 copay, and then again, it pays 60%. You pay 40%. So after your deductible, when you get over to medical attention, if you go to the emergency room, $500 copay. Again, they're just trying to say, please stay out of the emergency room unless it's really emergency. Urgent care visits, $100. Urgent care facilities charge more for an office visit than just a clinic because they treat some urgent care things. So then when you get into hospital stay, there is a $250 copay. For inpatient stay, then it pays 60%, and you pay the 40%, again up to $85.50. If you need mental health services or substance abuse, there is still the $50 office visit copay. If it happened to be inpatient treatment for those services, it would be a $250 copay at the inpatient facility. So pregnancy, really the same, 50, 80, depending on where you're seeing a primary care doctor or a specialist. So you go see an OB-GYN specialist, you go see a primary care doctor that delivers babies, or maybe that's where you go the first time because you don't know you're pregnant, and he can congratulate you and then maybe refers you over to an OB-GYN. Primary care doctor is still 50. And then all the way down, you can see that's 40%, meaning they pay 60%, you pay 40%. So that's page 5 out of 8. When you switch over to page 6, it just shows you some of the church services that they do not cover, okay, and other services that are covered. So chiropractic care is limited to 35 visits per year. They will pay for hearing aid, limited 1 hearing aid per ear every 36 months, and they have a place they want you to go to for that hearing service, and I think it's Beltone. But check before you go. It's not any audiologist in town, okay? Some of them don't accept anybody's insurance, so you need to make sure. But Beltone, I think, does, and they'll give you a discount. So, and then you can see the things that they're not going to pay for, never have paid for. So bariatric surgery, cosmetic surgery, those type of things. If you don't like the way your face was made, they're not going to pay to change it. Now, if you have a car wreck and your face goes through the windshield and it's all scarred up, yes, at that point they will pay for the surgeries to make that cosmetic surgery, get it done and improve your looks, okay? They don't pay for dental care for adults, generally speaking, but again, we've got the dental insurance. So there's that. So that's the 3 plans. Again, if you're already on the plan you want and you want to keep it, take the enrollment form that's just a couple pages back in your packet and fill that. Actually, it's the 4th page back from there. Put your name on the top in section 1 or section 2, excuse me, and put your name in there. Write same across the front, flip it over on the back, sign your name, and turn that in to Scott or Felicia. So right behind where we were there's MD Live. We've got telemedicine with Blue Cross. You can call a doctor on the phone. And the biggest thing there is it's the convenience of not having to go to the doctor office, maybe not be exposed to things that other people have that are waiting in that waiting room with you. You still have to pay an office visit copay, but they do have MD Live where you can call in and you talk to a doctor in the United States that's board certified. They're not like the people that work at my credit card company that you can't understand. Okay, so far my experience has been it's always been good. There is a number on the back for MD Live. Let me recommend something to you. If you're going to use this service, which I do recommend you do, that you go ahead and call that today while you're healthy if you're enrolled. Sign up, because it's just like any doctor. They slide a virtual clipboard through at you and they want you to answer all these questions. What medications do you take? What's your health history? What surgeries have you had? Because as they go to prescribe medications, which they will do many times, probably 85% of the time, they give you a prescription, they call it into the local pharmacy. So you need to have the phone number for your local pharmacy available. Okay, but they want to know all that stuff about you. Well, do that today while you're healthy. Because at 3 a.m., when you got 103 degree temp, and maybe you're throwing up so often that you can't hardly talk, you know how those things can be, then you don't want to take that 10 minutes to fill out all that information. So do it today for you and your family, if your family's covered. And then when you call in, they're going to answer the phone. They'll be able to see that, oh, you've already filled this out. Has anything changed? And if it has, you tell them. If not, of course, you go on. And then they ask you why you called. They screen the call. They determine, can we help this person? Because if you say, I've got chest pains, my left arm's numb, they're going to say, hang up and call 911. Okay, so they're going to determine if they can help you. And then they tell you, a doctor will call you back in usually 2 to 15 minutes. My own experience has been it's closer to 2 than 15. Occasionally, especially during the first part of the COVID thing, they literally were getting so many calls at some of these telemedicine things that their system wouldn't hold that many calls. And I actually myself called in. A day later, nobody called me back. So I called the company and they said, go online, we're having problems. So I went online and enrolled there, signed up for a doctor to call me back. I specified the time. The doctor called me back within 10 minutes of the time. And then I explained, well, hey, I called a day and a half ago. Nobody's called me back yet. And he explained, yeah, before COVID, we had a $4,000 call, or $4,000 call limit in our system. And after 4,000, it just pushed them out the back door. And they were getting so many calls, it was just pushing them out the back door. They had never experienced that before COVID. They've corrected it now, so that shouldn't happen. So hopefully we won't have another COVID thing going on. And I know you guys know more about that than me, but this is for the simple stuff, and it gives you even an example. So do that. Call MD Live. Right behind that is another thing that's free. It's Nurse Line. So you've got, especially parents, you know, when my kids come, they weren't born with a book on how to raise kids or how to make smart decisions with sick kids. So we used to call our pediatrician you know, late at night sometimes because we're panicking. We didn't know what to do. And of course, this didn't exist. 24/7, you can call a nurse and say, here's my situation. What should I do? Okay, maybe little Johnny's got 104-degree temp, and they can tell you to put him in a tempered bath. I just sprained my ankle playing softball today. Do I put heat on this or do I put cold on this? What do? They can tell you what to do, because actually some of that stuff has changed. When I was a kid, it was heat. Now it's put ice first and then heat and alternate. And they could have even changed it since then. So Nurse Line, use it. It's free. Here's the rates. All 3 plans. Find your age. That's the rate. You want to cover your spouse? Find their age. That's the rate. You want to cover your kids? Find their age. That's the rate. They'll never charge you for more than 3 kids, and it's going to be your oldest 3 kids up to age 26. Once they get 26, they come off the plan at the first of the month after their 26th birthday. So if you've got 5 kids, they're going to charge you for the oldest 3. But number 4 and 5, there is no charge for them, okay? That's the only reason that I know that you might want to have more than 3 kids. But I know a lot of people. We've got one client's got 10 kids, okay? Can you imagine? Just buying shoes would scare me to death. All right, so there's the plans with the rates, and that should answer your questions. Right behind that's the enrollment form. All right, here's the enrollment form for you. Again, if you're staying the same, you're not enrolling anybody, you're not changing plans, please put your name under section 2, write no change across the front, go back and sign it under section 9 and turn it in to Scott or Felicia. All right, if you are adding dependents, you'll need to list their names. If you want to change plans under section 2, you'll need to give us which plan you're going to pick. And it's going to be in the small group plans. Y'all are still in the small group world. When we wrote your group with Blue Cross, you had less than 50 employees. So that's been quite a while ago. But you're still there. We've got a plan that is really designed for groups of 2 to 50. And so far, it's not benefited Brightstar to move you out of that world over into the larger group plans that they offer. So you're going to have to tell them the plan number. Are you picking PPO or HMO? The Blue Advantage HMO, not Blue Essentials, Blue Advantage HMO is the plan. Okay, so please get that turned in. Behind that, you're going to find some general notices, one of them being about COBRA, one of them about HIPAA, privacy notices. All of these things are in there. We don't have to read them to you. The law says we give them to you. If you're having a hard time sleeping and you can't fall asleep at night, get these, and it's almost guaranteed that you'll be asleep almost immediately because they're really boring reading, but it's there for you to read, and we are just complying with what is required, that your employer give you a copy of that. So that's the health side of it. Now we're going to transition over to the dental side of it. All right, let me at the same time say, if you have questions, our phone number right here in Lubbock, 122nd and Quaker, 783-8959. Ashley Allen is my assistant, myself. You can call, ask questions about any of the health plans. We'll be happy to help you. Right behind that is the Principal Mutual dental plan that is offered. So go look at that. Nothing has changed on that other than they had a very small increase. So the dental rates are $31.46. You'll actually see those back in there. The vision rate stayed exactly the same. So you have access to dental or vision. You can enroll for both. You can enroll for vision only. You can enroll for dental only. You can put your dependents on one of them and not on the other. And it has nothing to do with your Blue Cross enrollment. Okay, so don't worry about, oh, I carry my dependents on the health. Do I have to carry my dependents on the dental vision? No, you do not. And they don't even have to be the same. So the dental plan stayed exactly the same. It's still a $50 deductible. You've got 3 deductibles per family if you carry your family. There is a $1,000 maximum benefit per person. It's got orthodontic benefits in there for $1,000 maximum lifetime. So on orthodontics, it's not an annual maximum, where on the other, every year on January 1, you start over with a new $1,000. The orthodontics is $1,000 per lifetime per child. It only covers kids up to age 19. All right, so not adult orthodontics. If you've got more than $1,000 worth of work that needs to be done, so you get to the end of the year and you need 2 crowns, and they're both $800 each. You could do 1 crown in December, January 1, you've got a new $1,000 benefit. So in January, you get the other one done. So sometimes you can stack your benefit, or you can wait to take advantage of the fact that you've gone through 2 years and you actually have 2 years to do it, or a new year with a new benefit. For the basic stuff, it's paid at 80%. For the major stuff, it's paid at 50%. They go through and define what are basic services, what are major services. Of course, major services are going to be your crowns, inlays, onlays, dentures, even root canals, that type of thing is over on major. So this is what we'd call a basic dental plan. So trying to keep the cost down to where it's affordable to you because you pay for it. All right, so the rate, $31.46. If you carry spouse and kids, you can see the rates. For the vision, it's only $8.50. And the vision benefit also is with VSP, Vision Service Plan. We find that to be the most preferable vision network. So vision's one of those that's really important for you to go to a VSP provider. On the dental side, you can go to any provider. Blue Cross does have a pretty big list of dentists, but most of them you've never heard of. The guys that have been around, my own personal dentist has been in business for years. He doesn't take any insurance company. His practice is good enough. You call him and you want to get your teeth cleaned, it'll be 3 weeks before you can get in. If you want to have any real work done, it may be longer than that. So generally speaking, those that are established don't take insurance. But there are dentists that do, and if you see your dentist on there, you'll get a dental discount. So that helps your $1,000 stretch out and cover more services, okay? So you might want to do that. But on the vision side of it, VSP, it's a big deal. Go to those guys. You can get a office visit exam for $10. All right, my eye doctor, who does not accept the vision plan that we have, but she's my client, okay, about $130 for an exam. All right, VSP, you can get $10. So consider doing that. If you're on it, you probably already know this. Nothing is changing on the dental or the vision. So as you look down through the vision, it's all exactly the same. So just know that. If you go out of network and you use like in my case, you use an eye doctor that's not in, they'll reimburse you $45 for that eye exam. That maybe cost you $130. Okay, so that's the difference. It's a big difference. Okay, but the choice is yours. The rates are next for the dental vision, and then right behind that is an enrollment form from principal. If you're not in the dental or the vision and you want to get in, you can do that effective 8/1. You do need to complete the enrollment form. If you're going to carry dependents, list them and turn it in to Scott or Felicia. And again, the sooner you do that, the better. Again, we'll be out to the stores or to your offices here in Lubbock on the 13th, up in Amarillo on the 15th, and you'll see me there. So if you have questions, maybe you watch this video and you still have questions, if you want to come see us, I think both of those meetings are at 3:30 in the afternoon, and I'll be there to answer questions and for those people that want to come. Other than that, that completes today's go over on it. So we've explained everything, and again, call us if you have any questions, and I appreciate your business and look forward to seeing you. Thank you very much. Bye.